biopharma through the innovation severe society of humankind. The topic of today's webinar is a dosage reduction strategy in rabies management of role of novel vaccine. Dear doctor, rabies is the world's first 3-dose anti-rabies vaccine, and with great pride, would like to inform you that the rabies was a successful completed 1-year launches, and within with more than the 40% animal bite, the victim beginning vaccinated 100%. Compliance reduce the no case of ADAS was registered. With this, it's my honor to introduce the speaker of today's webinar, Sir B.S. Chauhan, MD Pediatrics, very renowned name. He is based at Agra and very big renowned name in Agra city, sir. Now I look requested to doctor initiative talk about later. We have the after the session of question answer. Sir, please start. Prabal.
Sir, yes, sir. Sir, now you can start. Hello. Hello.
Sir, please start, sir.
Sir, I think there is some technical issue in headphone, so I hand over to sir. आप इस कनेक्ट करिए, आवाज इसमें आती रहेगी, इससे आप सेलेक्ट कर दीजिए. हाँ, कोई दिक्कत नहीं. हेलो. हेलो.
Yeah, sir. Audible, sir.
Audible to me.
Yeah,
My sound
audible,
is correct.
प्रबल एक स्पीकर बंद कर दोगे, आवाज वीक हो रहा है.
Sir, now is okay. Hello.
Yeah, sir.
Yes. Yes. My voice is audible to you or not?
Yeah, audible, sir. Audible, sir.
Sound disturbance. Sir, hello.
Voice is audible, sir.
सर कुछ डिस्टर्बेंस आ रहा है एक्चुअली में. सर टैबलेट में से आवाज नहीं, वो लैपटॉप में आवाज नहीं आ रही है, लीड से फोन से कनेक्ट होके आ रही है, तो वो कुछ इशू आ रहा है थोड़ा सा.
ना हो तो मोबाइल से अपन स्लाइड जो चेंज करना है लैपटॉप से कर लो.
बट सर आवाज वॉइस सही नहीं आ रही है सर.
मोबाइल से कर दो ना, मोबाइल से भी कर दो कनेक्ट.
यस सर, यस, बिकॉज आप लोगों की आवाज क्लियरली हो रही है. शो
आवाज, हाँ आवाज क्लियर आ रही है.
Hello, now sound is audible. Yes.
Yeah, sir. Start. Please start, sir.
No. This is the session. I'm starting. करिए, मैं बाहर जा रहा हूँ, इससे आप फ्री कर लीजिए.
या आ रही है सर, आ रही है सर, आ रही है.
Hello.
Yes, sir.
You are audible to me?
Yeah, sir. Audible, sir. Audible.
Yeah. Now, this is the introduction of novel 3-dose 3G protein vaccine, ultimately key for the compliance of the patient for the purpose of prevention of the hydrophobia, the disease caused by the dog bite. This is a new only 3 doses. Up to now, whatever the vaccines was there available in this scenario was 5 or 7 dose vaccine, but this is the vaccine only for 3 dose, so that the people can take it easily and there is no pain even after taking this vaccine. Globally, 59,000 human deaths annually, highest in the India. India has got 20,000 human deaths a year from rabies, accounting for 60% of the deaths by rabies in Asia and 35% globally. 91% deaths in India occurred in the rural area. Therefore, this is very important vaccine to take and have a good compliance for the prevention of the rabies. Local wound treatment, first aid, active immunization, and passive immunization. 3 types of treatment are there after the dog is biting to any person. Rabies, post-exposure and prophylaxis, and pre-exposure prophylaxis. This is post-exposure prophylaxis to local wound treatment, number 1. Number 2 is active immunization, and the other is passive immunization. Next. Current rabies vaccines are cell culture vaccine, CCV. Inactivated vaccines are more than 50-year-old technology and inconsistent in potency, stability, availability, short supply, and adverse events. Therefore, non-compliance is there. Complaints are there who receive the full course of ARV, that is the scheduled dose of ARV on the recommended dose. Delayed compliance is due to who completed the scheduled dose of ARV within 16 days, 60, but deviated from the scheduled regimen. Number 3 is the dropouts who had taken at least 1 dose of anti-rabies vaccine after annual Y, but not completed all the scheduled vaccine doses. Next. The rabies post-exposure prophylaxis practice in view of new center of the disease control and prevention, and WHO recommendations are there. A retrospective analysis done at travel clinic, a total of 110 patients who received rabies 4-dose PEP, and the shortcoming in the management of these patients were late initiation of the rabies PEP in the travelers, administration of human rabies immunoglobulins, and the antibody level less than 0.5 IU per ml in 6 of 90 patients, that is 6.7% after 4 doses of the vaccine. Concluding about their patients do not always receive the optimal rabies PEP under real life conditions. A significant proportion of patients did not develop adequate antibody level after 4 doses. Therefore, the reason for the death may be due to the lack of administration of the rabies immunoglobulin for the poor compliance to the vaccine. You see, in this only 3 doses, some persons are taking. The study was done on the 58-year-old female, and only three doses she received, and the result was that she died after 16 days of the admission in the hospital due to LAMA. This is due to left against medical advice, and she did not follow the scheduled treatment as was recommended. Other patient was 38-year-old male. He also received only 3 doses, and that was also after taking the dose, not completed the full course. Therefore, the result was not proper, and he also left the hospital without any advice, LAMA, and ultimately he was not saved from the death. And the third was the 34-year male. He also did the same thing after taking 3 doses. he did not follow the proper treatment, and therefore compliance was not good, and he also expired on the second day. Next. Compliance of post-exposure prophylaxis among the animals by patients. A hospital-based epidemiological study was done, and you see at Safdarjung Hospital, New Delhi, on 360 animals by patients, a pre-designed, pre-tested, structured questionnaire was administered by the interview technique. And it was noted that 53% were non-compliant to the full course of anti-rabies vaccine. Next. Compliance to the end, therefore 28 was 60, 40 on 7 was 85, on 3 and 0 was on 100, on the first day it was 100. At municipal Bangalore, this was done on 215 animal bite patient, 1 dose of rabies vaccine administered intramuscularly on day 0, 3, 7. For compliance of the complete course. The compliance rate of the intramuscular rabies vaccine was only 60%. Next. Therefore, the category name was interference with the school timing was 11%. Distance of the hospital was 11%. Post incurred was 13%. And forgotten dates was 18%. The major concern of the compliance to the complete ARV was loss of rabies. Next. On that time in 1885, when this was started, this vaccination against the disease was started, and on that time, number of injections were 31 for increasing immunity. In 1911, the minimal rural content liquid preparation came, and the number of injections, and now standardized 1976, the lympholyte vaccine, this number of doses reduced to only 5, and yes, non-compliance led to evolution. Regime from 31 to dose 5, and till date this 5-dose schedule is going on, meeting the unmet medical needs, introducing a novel vaccine. This simple and shorter vaccine was started now, and the availability of this novel 3-dose, only 5 doses to 3 doses has come. And recombinant rabies G3 protein, the first protein subunit vaccine by the BLP platform technology. First vaccine with 3 doses intramuscular regimen started now by our company Pedla, and better compliance due to easy to follow the regimen and less pain. Convenience, ready to use, no reconstitution, and we have to use as such. There is no reconstitution of the vaccine. Therefore, they open vial and give the vaccine, no problem. Novel 3-dose recombinant rabies G3 protein vaccine is very easy and can be done. Next. This PEP technique is native virus was corrected, and after that the protein is difficult to stabilize. G protein isolation using BLB and nanoparticles, the particles, but that do not contain the viral genome. Number 3, next is they cannot replicate but can mimic the viral antigenicity without being pathogenic. Comparable to of inducing a strong humoral and cellular immune response. And the next, ultimately, the BL as the vaccine are available in the new vaccine. This is 3 doses only. And the next study designed by 0 to 3 doses, 0, 3, 7, 3 doses only, 10 microgram on the 50 persons, 10 microgram on 50%, 0 to 3, 0 to on other vaccines, 0 to 10, 0, 3, 7, and 5. You see on the other hand, Revipur was given 0, 3, 7, 14, and 28. Therefore, the 5 doses schedule has been reduced to only 3 doses schedule. New protein vaccine by Cadila Pharmaceutical Company. Safety and immunogenicity of the novel 3-dose recombinant nanoparticle rabies G vaccine administered as the post-exposure immunization. It recommended comparator controlled multi-center phase 3 clinical study. And next, to evaluate immunogenicity and safety of the rabies 3 protein vaccine administered as a simulated post-exposure immunization in healthy volunteers, randomized comparative controlled multi-centric study. Total subject was 800 and the randomization was 2:1. TS rabies, you see on other hand, you see the rabies for the reference. TH rabies vaccine was given 0, 3, 7 days regime, 533 all subjects were well immunized. On the other hand, you see even after 5 doses of Revipur, the result was only on 267 subjects. Therefore, results are comparable in this rabies vaccine. Facility efficacy, you see, the seroprotection is better, safety is better. Novel 3-dose has better safety profile, significant less than AEs compared to references. The results were different centers and gender and of the difference. That was the very good and productive. Next. Conclusion, you see, novel 3-dose non-interfere to the reference vaccine, less adverse effect compared to reference vaccine. Novel 3-dose vaccine found to be safe and immunogenic and was comparable to 5 doses of WHO pre-filled vaccines. Pharma innovation of this year was given to Therapies and the Golden Global Tiger Award of Malaysia was also given to Therapies. Thank you.
So, Suman sir,
Hello.
Hello.
Haji.
First of all, thank you so much, sir, for this wonderful presentation.
Okay.
Sir, there are a few questions which I can see which are lying down in the comment section. First
Yes.
question is, what are the major symptoms, like if somebody is getting rabies or somebody is having
Sound is
what are
not audible.
the
Please say again.
symptoms, sir? What are the symptoms of rabies?
Hello.
Patients.
Hello. Please say again.
Hello.
हाँ जी. Yes.
Sir, पहला क्वेश्चन ये है कि what are the symptoms in rabies? If somebody is suffering from rabies, तो क्या initial symptoms देखने को मिलते हैं?
Symptoms are this is the patient is there is a history of dog bite. Number one. Number two, the patient is horrible and the senses of the person is less. Patient is irritable, drowsy, and hesitating from taking water orally. The pharyngeal muscles do not work, and the brain is occupied by the hydrophobia virus.
One more thing is that, so how 3 doses better than 5 dose in compliance? Like आपके practice में, you might have seen patients. So ऐसा हुआ है कि like there are patients who have missed the 5 doses. So in your cases ऐसा हुआ है कि like 3 doses के बाद patient ने dose लिया नहीं है, and after 6 months or 7 months they are coming back with rabies symptoms.
3 doses schedule is very good because one is the fear from the injection. The person who take the injection, they are having fear for five injections. Number two is there only 3 days is saved by the patient to take a vaccine. Number three is the course is completed early and the immunogenicity is better as compared to 5 doses. So post-exposure prophylaxis is 100% covered by this 3 dose schedule. 3 doses can be given easily and the time consuming and economic and not patient is also following this schedule. This is very good.
So much, sir. Thank you so much for your valuable time, and I also thank all the doctors who have given us valuable time for this lecture. Almost 120 participants are there who are joining this session, and thanks to you for giving these valuable lessons and you, sharing your personal experience regarding the rabies and sharing your point of view about it. Thank you for making your time, valuable time for this. Praval sir, please continue.
Okay.
Okay. I also thanks to Dr. Chauhan sir. Ma'am, there is some technical issue regarding headphone. So,
Yes.
but anyway, sir doing very well and all slides he gone through. So I sincere thanks to Chauhan sir and all the participants. Sincerely thanks for joining with us. Thanks a lot.
Okay.
Thank you, sir. Thank you so much.
Thank you, ma'am.
Good day, sir.
Thank you.
Good.
Tech support, we can discontinue.
Okay.
Okay, thank you.
Okay.